It's my pleasure to introduce Dr. Esther Sternberg. I've known Esther for a number of years. She and Kevin Kamsher and I worked together on a project that will be discussed later on in Denver. But Esther has been an international leader in the field of mind-body interactions, and she wrote a wonderful book called Healing Spaces. It's so readable. It takes it's like reading the New York Times science page, and even better than that. So it's well worth getting, because it goes into the science of our links to the environment, but in a way that's very, very accessible. So Esther has done amazing research. She's still doing it. And she's now at the University of Arizona, where she's a professor of medicine, and she has many hats there. She's the executive director research director of the Integrative Medicine Center, and she founded a new center on place and the Institute on Place and Wellbeing that has just gotten started, and she's doing lots of other stuff, and she's going to talk about that today. But we're really, really glad to have her be here and talk about this in a general way, what we're learning and what's the importance of this, and how do we begin to move this forward into the world. Thank you, and here's Esther.
Wow, well, thank you, Judy, for that really wonderful introduction. Where's the little clicker? Oh, thank you. So, can you hear me if I stand a little bit away from the microphone? Oh, for the webcast. Okay, so we're tethered. I believe in wayfinding around the podium. So thank you again, Judy. It's really a joy and pleasure to be back on home turf here at NIH, where I spent 26 years in the intramural research program. And it's a thrill also to have Bill Riley speak, and we were partners in crime, I would say, in trying to push this model. What? Sorry, am I not? Okay, sorry. So this is the model of health that I thought of for 26 years while I was here at the National Institutes of Health. My research focused on the science of the mind-body connection, and how the brain and the immune system talk to each other, how they regulate each other, how the hypothalamic pituitary adrenal axis stress response regulates the immune system, and how the immune system talks back. There's something very important missing from this slide. Can you guess what it is? It's the skull. It's the rest of the body. It's all the people around, and it's the environment around. So we're talking about stress and the immune system. And part of the thrill of doing talks with various electronics is that there's always a little element of stress that's important, because you need your stress response to function at peak. You do not want to be relaxed and sleeping all the time, and I'll get to that in a minute. But as long as I was here at NIH, this is how I thought about health. And when Kevin Kamsher, who was then director of research for the General Services Administration, first approached me and Judy Heerwagen about in 2000, I would say, it was before 9/11, and asked, how can we measure the impact of the built environment on human health, performance, and productivity, ultimately, if what the product is not widgets, but actual creative process or products. And so I told Kevin at the time in 2000, as you mentioned, the ways of monitoring the physiological stress response were dinosaurs compared to now. But we did have heart rate variability monitors that were fairly big, and that was fairly reliable. And I said to Kevin, well, we can measure the immune system, we can draw blood. And Kevin said, no, you can't draw blood, these are office workers. So I said, well, how am I going to measure the immune system? He said, that's your job. figure it out. I'm still figuring it out. You'll see 15 years later, I'll show you that data. But when I left NIH, I created this Institute on Place and Wellbeing at the University of Arizona, linking the Arizona Center for Integrative Medicine, the College of Architecture, Planning, and Landscape Architecture, and the College of Medicine. And the great thrill of being there at the University of Arizona is this is really, it's enthusiastically supported by the entire hierarchy, the president, the provost, vice president of research, and so on. And many colleges have joined in this effort. And it speaks to the kind of interdisciplinary expertise that is necessary to answer these kinds of challenges. We can't do this without the engineers, without the analytical chemists, without the humanities, without the psychology, behavioral sciences, and of course, biomedicine. So I'm going to talk to you about the research and also the policy implications of what we're doing. So this is basically what we're doing, or this is our vision, our goal. We want to be able to, and we are currently in various stages of measuring everything from the airflow, air chemistry, temperature, humidity, architecture, noise, sounds, views, light, materials, greenery, and mapping that on to the human behavioral, psychological, physiological, and molecular responses in real time. And ultimately, we could do it in real place. There are privacy issues related to that, but we can talk about that later. So the research that we're doing is divided from really the applied part, which goes from the very second to bottom layer, stress load, all the way on up, which I'll be talking about very briefly, and Casey Lindberg, our postdoc at the University of Arizona, will be talking about in more detail in a later session. But this applied piece is being done with the U.S. General Services Administration, with Kevin Kampscher, Judy Heerwagen, Brian Gilligan, and Kelly Canada, who are sitting there in the audience, and several other researchers, and I'll describe that in detail. And then the bottom one is what we're doing in terms of developing methods to measure proteomic responses, molecular responses in sweat, non-invasively in real time. That's not yet for prime time, so it's not connected. Ultimately, we want to be able to connect all of this. So getting back to the brain-immune connection and the stress response, too much stress is not good. Too little is not good. And when I talk about stress, I mean the physiological stress response, which is comprised of the hypothalamic pituitary adrenal axis. That's the brain's hormonal stress response, which ends up in release of cortisol. Cortisol is the most potent anti-inflammatory drug that your body makes. So whenever you're stressed, you're pumping cortisol into the system and tuning down the immune system's ability to fight disease. There's also the sympathetic nervous system, which is your adrenaline response, and that's what makes you feel the way you feel when you're stressed, your heart beating fast, sweaty, running to the bathroom, and so on. And all that also affects the immune system. So what we know from decades of research is chronic stress impairs the immune system's ability to fight disease. So chronic stress, and a lot of this is done by Jan Kiko-Glaser and Ron Glaser at Ohio State University. Chronic stress results in increased susceptibility to viral infections, increased frequency. If you go out to get a flu shot and you're chronically stressed, you're a caregiver of an Alzheimer's patient, you have less of a take rate for the flu vaccine. Prolonged wound healing, speeding of cancer growth, that's Susan Lutgendorf's work, and speeding of chromosomal aging. So it's not that stress causes all these things. Stress doesn't cause the flu bug causes the flu. Stress doesn't cause wounding, wounding causes wounding. Stress doesn't cause cancer, your genes and environmental factors cause cancer, and stress doesn't cause aging. Sadly, aging causes aging. But when you are chronically stressed, your body's own endogenous mechanisms to heal are impaired. So that's why all these things are worse. If you're chronically stressed, your chromosomes look 10 to 17 years older than your biological age. So for the young ones amongst you, you may not care. I care a lot. 10 to 17 years is a long time. So, but what I said earlier is that you need your stress response in order to perform. People tried to make transgenic animals, transgenic mice, without a hypothalamic pituitary adrenal axis response that's not compatible with life. You need your stress response to focus your attention, to fight or flee, to get out of danger, to perform at peak. So if you imagine a rainbow over the stage, if I were totally relaxed and I were over at the other end of the stage, I would be lying down, pretending I'm at the beach, actually sort of like at the beginning meditation that we had. And I'd be relaxed, you'd be bored, and Judy and Charlene would be stressed. But so I have to get myself up to peak performance, which is very convenient with traffic and, PowerPoint issues and so on. I'm always at peak performance when I'm speaking because I have my stress response turned on. And this is in terms of what we're talking about. In office workers, you don't want your FBI workers to be meditating and sleeping, right? You want them to be at peak performance. And the issue becomes if you become extremely stressed and you fall over this inverted U-shaped curve, the Yerkes-Dodson curve for those of you who are behavioral scientists. And people have done these kinds of studies in monkeys with implanted electrodes in their stress centers in the brain, and you can actually see single nerve cell firing that correlates with the various abilities to perform. And when you're extremely stressed, you have massive single nerve cell firing across the board, sort of like email spam. And the only way to improve that is what you do with your computer, shut down and reboot. So we seem to know that about our computers. We don't know that about ourselves, or at least many of us don't. In Italy and Germany, physicians can prescribe a stay at a spa. Is that true? Yeah, and it's covered by the government for burnout. So we're not there yet. So if we know this, if we know that stress can cause illness and that the state of the stress response can impact performance, why don't we build our buildings to optimize those conditions? It doesn't make sense to put somebody into a hospital that is already a person who's already stressed, who's already sick, and you put them into a building which contains mazes, foul odors, crowding, irregular temperature, too much, too little, bright, shiny lights or dark, scary passages, too much noise, as in intensive care units up to 90 decibels has been measured. It doesn't make sense to put somebody in that situation or to have people who are caring for sick people working in those conditions. And, there's some amongst you who are very expert for about 30 years, I would say, right, designing hospitals to minimize those aspects of the environment that are stressful, but also to enhance aspects of the environment that improve well-being. So what we want to do here, as Judy mentioned, is go beyond removing the negative. That's the basement. That's necessary. And that's been true for, I would say, probably about 30 years or so. There's been close relationship between the building designers and facilities managers and occupational health to remove environmental toxins, right? That's a given. We're talking now about adding features that enhance well-being, sound, nature sound, quiet, music, light, full spectrum sunlight. You're going to hear from Mariana Figuero about the circadian light later on. Temperature, humidity that is comfortable. Beautiful views of nature. This is universally preferred scenes, are sweeping vistas of nature that calm. Fragrances and labyrinths. Labyrinths are different from mazes because they're walking meditations and you don't have to think of where you're going, so it slows you down and you have the combination of exercise and meditation. In fact, across the street, if anybody has a chance to go over to the Navy Hospital, the Walter Reed National Military Medical Center of Bethesda now, they have 2 labyrinths there at the NICO Hospital. So this is what the goal is in terms of applying these principles to design. And the question becomes, how do we design the indoor environment for optimal occupant health, performance, and well-being? And, of course, this is environmental psychology. Roger Ulrich published a study in 1984 in Science magazine where he showed that patients with views of trees versus a brick wall had shorter hospital stays, less pain medication, and fewer negative nurses' notes. We have advanced enormously in terms of the ability to measure outcomes now compared to then, but this principle has stood for 30 years or more. And in terms of the design profession, the bottom line is what's going to convince your clients to spend the extra money to do this. So the Center for Health Design in San Francisco did outcome studies on what they call a Fable Hospital as part of the Pebbles project, where they actually measured in hospitals that were retrofitting various wings, whether it was emergency rooms or internal medicine or intensive care units and so on. They measured about 50 different hospitals and found that overall there was a decrease in patient falls, decrease in medical errors, decrease in hospital infections, decrease in pain medication use, decreased nursing turnover, and improved staff and patient satisfaction. And all that was good for the bottom line, where the cost of building such a Fable hospital was about $12 million extra, they calculated. In the first year, they saved about $11 million. So what's good for health is good for the bottom line. So when Judy and Kevin approached me about 14 years ago or so, they wanted to extend this to office building design. So we did a study which we published in 2010 with Julian Thayer, who was at the Aging Institute at the time and is now at The Ohio State University, and he's also advising us on our current project. And we compared federal workers in a building that was being retrofitted, and we looked at people in the old space, and you can see that it's dark and cramped and fairly typical federal space of the time, poor lighting and ventilation. And we looked at their stress response in 2 different ways: heart rate variability, which measures the neuronal stress response, and I'll show that in a minute. And we also looked at that hormonal stress response, the salivary cortisol. And we compared the responses in the new space, which was open, airy, had beautiful views, natural light, good ventilation. And it turned out that the people in the old space had lower heart rate variability. That's worse, okay? The way to remember heart rate variability is more heart rate variability, higher heart rate variability is a good thing. Lower heart rate variability is a bad thing, because what's the single worst heart rate variability that you could possibly have? Flat line, right. You do not want that. You want lots of variability. So low heart rate variability correlates with increased stress response, increased adrenergic sympathetic nervous system stress response, and decreased vagal response. And it's probably more reliable for the vagal response. I'm looking at Bill because that's his expertise. And what that is when you breathe deeply, like we were all doing at the beginning with the meditation. Everybody take in a deep breath and then breathe out. And if I had heart rate variability monitors on every single one of you, I would probably be able to instantaneously measure that your vagus response, your vagal response, your heart rate variability would immediately increase. And when you're stressed, it immediately decreases. So we found that in the people in the new space, they had greater heart rate variability than the people in the old space, and they had greater diurnal variation. So the difference between the morning and the evening was greater, and that's also a healthier response. Similarly, we found lower cortisol responses in the people in the old lower cortisol response in the people in the new space compared to the old space. Lower cortisol means you're less stressed, and especially the most sensitive one is the early morning rise. The amount of rise in cortisol that you have in the first 30 minutes of the morning predicts how stressed you will be during the day. I guess if you're stressed and you wake up and you think about all the awful things you have to do during the day, that really, really pushes up your cortisol. Another really good way of pushing up your cortisol is public speaking and mental arithmetic. Also, glucose reduction if you're hungry. There are several ways to stimulate the cortisol response. However, in this case, what this showed is on two separate physiological measures. We found that the people in the old space were more stressed than the people in the new space. We did not define what elements of those spaces made the difference. We just knew that the two different groups were different. And we did not find, interestingly, a difference in their psychological perception of the stressfulness of the two spaces. And that's one thing that's really, really important, that environmental psychology up until this point relied almost entirely on question and answer.
Please pardon the interruption. Your conference contains less than 3 participants at this time. If you would like to continue, press star 1 now, or the conference will be terminated.
Okay, bye. That's better than the hook.
We didn't plan this, Esther.
We want to check your stress.
I know. We should add that to the public speaking and mental arithmetic. I'll be right up there. Yeah, the voice of the Lord. So where was I? Cortisol. So the important thing is that people were not subjectively aware of the difference. And think about it, unless you're a designer.
Please pardon the interruption. Your conference contains less than 3 participants at this time. If you would like to continue, press star 1 now, or the conference will be terminated.
This is great.
We can call the teleconference.
Oh, why don't you do that? Because I don't have a way of calling the teleconference here. Yeah, that's right. It'll be more than 3, so everybody please call. No. So this is, unless you are a design professional, you're not really aware of how the physical environment affects your moods. You walk in, the shopping industry, Disney, all take advantage of this, right? You walk into a place, you have the restaurant industry, you have no idea why you're feeling suddenly relaxed or you're feeling...
Please pardon the interruption. Your conference contains less than 3 participants at this time.
Somebody needs to do something.
If you would
about
like to
this. Can I
continue,
unplug
press star
something?
1 now, or the conference will be terminated.
There's no way to press star 1. Maybe I do star 1 here. I don't see a star. Yeah, okay. So I think this is a really important point, and this is what led us to do our next set of studies. So getting back to this biomedical model of health, which, by the way, I should say that when I was at NIH, and I think, Bill, you were part of, yes, you were definitely part of this. I was chair of a committee that was...
The conference is being terminated.
Good. That's great. That's what we want. I chaired a committee for the Central Tenure Committee that was unfortunately named the BURP Committee. The Behavioral Investigators Research and something committee. And it was an attempt to get more behavioral researchers at NIH because the vast majority at that time thought of health in this way, in the biomedical sense. And I'm glad to see that there seems to be a much greater behavioral and social sciences component here that takes into account all of what Bill was talking about. But when I was here, we talked about, okay, how do we measure all of this non-invasively and in real time? And of course, we have the psychosocial moods and the mood scales, and that's important. You have to have the psychosocial scales. You can't not have them. We can measure cortisol in saliva. we could measure heart rate variability to get at the autonomic nervous system. We could not measure, as I mentioned, biomarkers in molecular biomarkers other than by drawing blood. So when I was here at NIH, we did some proof of principle studies and developed a method to measure stress and immune or neural and immune biomarkers in sweat. When I left NIH, actually the month after I left, I got a call from the Air Force Research Labs, and they asked me if I would join forces with them to develop this method further, to develop a method to measure stress and immune biomarkers in sweat in real time. And I asked the Air Force Research Lab researcher who called me, how are we going to do that? He said, well, I can't tell you. You have to sign an NDA. So I actually can't tell you how we're doing this. It's proprietary. But suffice it to say, we are teaming with the Air Force Research Labs and a consortium, a rather large consortium of industry, to develop a method or methods to measure molecular responses in real time. It's not going to be ready for, you know, the PMI initiative anytime soon, but I would predict that in maybe 3 to 5 years, there will be ways of non-invasively measuring molecules in real time using these kinds of devices. For the rest of that layer cake that I showed, we are currently working together with Judy Heerwagen and Kevin Kampscher and the team at the GSA to measure the impact of the built environment on human physiological, psychological, behavioral responses in real time, not in real place, because of the privacy issues. And that's presented an interesting challenge, but I think that we're figuring out ways to get around it. So this may be informative for what you're doing. We're partnering with a company called Acoma in the Bay Area, who has developed real-time environmental sensors. And I'm not going to talk much about this because Casey Lindberg, whom we hired to be the glue between all the groups in this, is going to speak more about it. We are linking the various aspects of the physical environment that include 12 different environmental attributes, linking them together with psychosocial responses through questionnaires sent on the smartphone, behavioral activity and stress responses through monitors, real-time monitors, and linking those with together using big data, which is the big challenge here of linking these massive different data streams together in real time. And we're developing the methods to do so. So we would be really thrilled to partner with you on that. So I'll let Casey talk more about that later on. The implications of this are huge in terms of policy. As you all know, the Surgeon General announced prevention strategy. There's a Surgeon General's National Prevention Strategy Council that consists of 26 federal agencies, including all of the cabinet members. The GSA is part of this. They've announced an action call to action called Walk. I can't remember now what it's called. Step It Up, right. And what you can see is a good quarter of this prevention strategy addresses healthy and safe community environments. So we're talking about all scales of the built environment that are important here. Again, there's been a natural, for the last 30 years, relationship between public health professionals and urban planners. And that's, I think, where this focus of the Surgeon General has started, at that nexus, to get more walkability in communities, in buildings, and so on. And what we're talking about is taking this to the next level and adding the individual built environment, the individual office space, the individual schools, individual homes, where people live, as Judy mentioned, where we spend our indoor time most of the day. Add that to this concept of healthy and safe environments. And this is, of course, as the design professionals in the audience know, being embraced by the standard setting and licensing organizations across the United States and across the world. So the idea of including human health and well-being outcomes as part of green, sustainable design is a movement that has taken off in the last couple of years amazingly. So we have here Susanna Kelly from the American Institute of Architects. She's going to be speaking later. American Institute of Architects is creating courses online. Can I say this? Oh, okay. Thank you. Now that I've said it. Online courses that will be required in order for architects to get their license to learn about the impact of the built environment on health. Of course, the U.S. Green Building Council is pulling out all of the aspects of their sustainable design that have an impact on health. Other organizations across the country are looking at doing the same. The Department of Defense is very interested in this, the Veterans Administration, and of course the GSA. I was in Australia, and the Australian Institute of Architects and the Australian Green Building Council are, I would say, leading internationally in this area. And the Catholic Health Initiatives is there because I was invited to speak at the Vatican on this issue. So when we talk about the breadth of organizations that are interested in instantiating the impact of the built environment on health and well-being, going all the way from the U.S. military and the GSA and the AIA to the Vatican, we're talking about a massive world movement that hopefully will help us to design a healthier, better world, to include human health outcomes in green design, and to include place and well-being and person and place-centered well-being in precision health or precision medicine. So that's really why I'm so excited to have Bill Riley have kicked off this conference, and the opportunity to partner with NIH is just tremendously exciting. And this is the large team at the University of Arizona that is working on this. You can see that they're from the Eller College of Management at the University of Arizona, the big data analytics, we have bioengineers, we have psychologists, and design professionals at the College of Architecture, Planning, and Landscape Architecture, and of course my team at the University of Arizona Center for Integrative Medicine and College of Medicine. And at the U.S. General Services Administration, we have an equally large team, and Acoma is the company in the Bay Area that has created these environmental real-time sensors that Casey Lindberg will be speaking about later. So it takes a village to do this, but I think we've got the right villages in the audience here. So thank you very much all, and I don't think we have time for questions, but if we have one or two, I'd be happy to take them. Well, so first of all, you're 100% right. And I think in hospital design, people have been thinking about this for a long time because it's not only throughout the day in any individual, but it's also your health status. If you're sick, you may not want so much light. The NICO hospital across the way, the National Intrepid Center of Excellence that was designed as a public-private partnership with the Smith Group, really took into account these issues where it's designed for post-traumatic stress disorder, wounded warriors with PTSD and traumatic brain injury, and they worked with their population of patients beforehand to find out what are the things that trigger those symptoms. So this is an extreme example, but I think when you can learn from extreme examples, and they found that bright lights trigger PTSD, dark shadows, overhanging balconies, the kinds of things on a battlefield that you need to trigger your stress response so that you're vigilant, you have focused attention. And so they designed the building to reduce all of that with skylights, not with bright lights, with calm, quiet noise, and so on. If any of you have a chance to go over there, it's worth to see what they're doing. And I think that those kinds of things can be brought into the general population, because as we go through our day, yes, in the morning we have a different, when we come home at night, we want to relax. We don't want to be zinged necessarily. So that's where the kinds of things that Bill Riley was talking about, I think, will be extremely helpful to have precision medicine or precision health will be able to determine in real time on a moment-to-moment basis the status of all of these systems and how they interact with the environment to ultimately, if you want to take it to a practical application, interact with the Internet of Things, to modify the environment around you, to optimize that health and well-being. I was talking to somebody, it might have been at the Robert Wood Johnson AIA Research Consortium that we were all over in Princeton together in the winter, that we talked about, you could modify the temperature in your office chair if you find that you're uncomfortable. And somebody said, well, I call that a sweater. So we may be going back to basics, but but we can do more than just put on a sweater, I think, at this point. Yes, Charlene.
Getting into that, while you're both here, getting really into the personal thing, I learned recently that many hypothyroid people have a very low cortisol response, and it is an issue. So this becomes a real, how do you account for things like this with personalized medicine as you start looking at some of the things?
Well, that's actually an interesting question. Are you going to do screening and make sure that people are completely healthy? I mean, I guess that's something we have to think about.
Yeah, so we'll be doing clinical exams, including some of those types of typical sort of measures and everything into the precision medicine. It's a really good point of how we coordinate, sort of looking at precision medicine sort of differently, and could we actually change the environment in a more precise way for certain people versus others.
Well, thank you very, very much. It's been a great pleasure. I look forward to the rest of the day.